One of the leading causes for the loss of tooth is dental caries. It is defined as an infectious microbiological disease of the teeth that results in localized dissolution and destruction of the calcified tissues. What are the factors that affect caries? Now, as per Caries, there are three factors. He said the host, the substrate, and the microorganism. That is the tooth, the food, and the microorganism. But if we don't brush for a day or two, does that really result in the formation of caries or a cavity in our tooth? No. So that is when Newburn put forward a fourth factor, time. So he said that in addition to the host, the substrate, the microorganism, time is a vital factor that results in the formation of caries. So Caries had the triad, whereas Newburn had the tetrad. Coming to the clinical characteristics of caries, we have plaque. Plaque is nothing but a gelatinous mass of bacteria that adheres to the tooth surface. When we get up early in the morning, if you run your tongue on the surface of your tooth, you find that it feels a bit rough. But if you look in the mirror, you won't see anything. That is your plaque. So if you see this picture, you can see that there are these two sets of teeth on the upper side. They look perfectly normal. There's nothing on it. But when they are given a disclosing tablet, we can see that the plaque takes up the pink stain. And this is actually a good diagnostic method to show children especially that they need to brush their teeth regularly. Otherwise, it could result in this. As you can see in the lower pictures, the cocci, the rods, and the filamentous bacteria that are present on the surface of the tooth in the plaque. Now, how does this plaque actually work? So, if there is a layer of plaque on the surface of the tooth, of course it has bacteria, for a day it's going to be all right. But if the oral hygiene of the person still continues to be poor, this thickness of the plaque keeps on increasing. And as it keeps increasing in thickness, what happens is the layer that is closer to the tooth surface starts to lose out on the oxygen. So this is a diffusion, this plaque forms a diffusion limiting barrier, which prevents the entry of oxygen. So the combination of this limited diffusion and a tremendous metabolic activity makes the environment, the local environment, closer to the surface of the tooth, anaerobic and acidic, leading to the dissolution of the subjacent tooth surface. So once that happens, a cavity is formed. However small it is, a cavity is formed. This gives the opportunity for the filamentous bacteria, which actually have a poor adhesive quality, or their adhesion is poor. So filamentous bacteria like lactobacilli, they grab onto this irregular surface and they bring about the progression of caries. So the microorganism that initiates caries and the microorganisms that progresses caries is different. Now, in the absence or the change of diet in the host, if the diet hasn't changed or the oral hygiene hasn't changed, then the cavitation of the tooth surface becomes a synergistic acceleration. In other words, it just progresses, it becomes more, the cavity becomes bigger, and this results in the massive destruction or the progressive destruction of the tooth surface. And once this caries reaches the dentino-enamel junction, then the lateral spread is faster because dentin is less resistant to caries attack when compared to enamel. Now coming to plaque hypothesis. Now there are two hypotheses, they are opposing. One is the non-specific plaque hypothesis and the other is the specific plaque hypothesis. So what does the non-specific plaque hypothesis state? It says that all plaque is pathogenic, all plaque. Whereas a specific plaque hypothesis states that plaque is considered to be pathogenic only when it is associated with signs of disease. Now, realistic realistically speaking, the non-specific plaque hypothesis means that you have to completely eliminate plaque in the patient, all the patients, and that is unrealistic. That's not possible. So it is a specific plaque hypothesis that is considered more than the non-specific. Coming to the organisms that are involved in the formation of caries. Caries in the enamel is initiated by the Streptococcus mutans, as you can see in the brightly green slide, the topmost slide. Then you have the Actinomyces viscosus, which is responsible for the initiation of root caries or the cemental caries, which you can see in the purple or the lavender slide. And then we have the Lactobacillus species, which is responsible for the progression of the dentinal caries, seen in blue. Now coming to the clinical sites of caries initiation, where does it start? So there are 3 distinct sites on the surface of a tooth, okay? So the first one is the developmental pits and fissures, which is found on the occlusal surfaces of the posteriors, the occlusal 2/3 of the buccal and the lingual surface, and on the lingual surfaces of the anterior teeth. Then you have the smooth enamel surface. Now, the smooth enamel surface is usually the proximal surfaces, namely the mesial and the distal. And usually it is more on the gingival aspect or gingival to the contact area, because that's an area which is difficult to clean and maintain. Also, it's found gingival to the height of contact or on the buccal and lingual surfaces also. So it's basically the cervical 1/3 that is affected. The third is the root surface or the cemental surface, which is also prone to caries. And usually we find that it's on the root surface is in older people because of either gingival recession or where they cannot, the dexterity has been lost and they're not able to clean the area at the cervical area of the tooth properly. Now, if you see the pits and fissures, they're of different designs. Like that's why we see that some people are more prone to caries than other people. There are other factors, a lot of factors, but one of them could be the design of it. So you find that the termination of the pits and fissures varies. It can be a shallow groove like we see in the first one, where this is very easy to maintain. So people who have this type, they have less chances of caries. Whereas if you see the second one, where there's a complete penetration of the enamel straight, it's very difficult to maintain and these people are more prone to caries. Even the pits and fissures that end blindly but are deeper are also difficult to maintain. And those that open to an irregular chamber also are difficult to maintain. So if you see, these last 3 ones are more prone to caries than the first one with a shallow groove. Now, caries in the enamel spreads parallel to the enamel rods. So if you look at it on the occlusal surface to the dental enamel junction, the direction of the enamel rods would be, it would look like it's an inverted V. Once it reaches the dentino-enamel junction, it spreads laterally and then it moves towards the pulp in a V direction. So on the pit and fissure areas, it appears like an inverted V on top of a V. But on the proximal surface, it appears as a V on a V. So if you see this, this is the inverted V up to the dentino-enamel junction, from where it spreads laterally and then it moves in a V direction towards the pulp. Whereas on the proximal surface, because the enamel rods are placed like this and their direction is towards the apical area, so as it comes like this, it appears as a V. Once it reaches the dentino-enamel junction, it spreads laterally and again forms a V. Now when we come to the root surface, because it's on the cementum, the shape in the cementum is a U shape. As we can see here, as a U shape, and then when it reaches the dentin, again it spreads in the V direction towards the pulp. So the best way to make sure that you don't have dental caries is to ensure that you brush your teeth and floss your teeth regularly. And this will prevent one from getting dental caries.